weather, actually with floods. This type of weather tends to give us cold spells, and more than that, it inconveniences many of our health. It gives us health challenges, and we often visit doctors more and more during this cold weather. The purpose of purposeful aging is actually to empower you.
Excuse me, Christine.
Yes.
The background noise is actually too much. You seem to have two gadgets on. Maybe you can turn off one. And Elizabeth Lona, if you can also mute, because otherwise we can't really hear.
I have one gadget on. Elizabeth Lona, are we okay now?
Have I muted?
No, you don't seem to be muted because we can hear you. Okay. Our mission at Purposeful Aging is to empower you with knowledge to navigate these seasons with confidence. Following last month's session, where we discussed disability and how to manage, especially hearing disability in our families, we are diving deeper this morning into the topic that affects most of every household during this type of weather. And we are honored to have Dr. Ricky Byaruhanga, a seasoned medical expert who provides us with professional sneak peek into the common changes and diseases of ear, nose, and throat, commonly known as ENT. I want to go ahead and introduce Dr. Ricky Byaruhanga. He's an ear, nose, and throat specialist, a dedicated Anglican priest, and a committed senior lecturer with passion for service through medicine, education, and faith. He has devoted his career to providing quality care to patients with ear, nose, and throat conditions, while contributing to the training and mentorship of future health providers. And this is at medical schools, first at Makerere University, and more recently at the Uganda Christian University. As a senior lecturer and current head of department at Uganda Christian University School of Medicine, he is actively involved in medical education, sharing his clinical knowledge and guiding students in both academic and professional development. Beyond his medical and academic work, Reverend Dr. Ricky also serves as a priest, offering spiritual leadership and pastoral care to the community. This unique vocation allows him to integrate passionate healing with faith-based guidance, reflecting a holistic approach to service that addresses both physical and spiritual well-being. Please join me to welcome Dr. Ricky Byaruhanga as he helps us better understand how to protect our health and that of our loved ones. Good morning, Dr. Ricky. You're most welcome.
Good morning, Dr. Christina Kadama. Thank you very much for welcoming me and for that very extensive introduction.
Yeah, thank you, Ricky. You come on just a minute.
All right.
I'm sure everybody is clapping to welcome you. So, Reverend Dr. Ricky, before you ordered out, now we are about 20 of us online, and we are very eager to hear from you. Together with people who appear on the screen as present, they are caregivers, usually beside the ordered outs, and they listening to whatever goes on, because ultimately they play a big role in helping the older adults. Yeah, many of them are not medical doctors and they are not students. And this is where your reverend side comes in very, very handy, as you are used to speaking to people who are not medical doctors, who are not students, in a language they understand. Reverend, please take us on in the next 40 minutes, after which we may, if you have time, we may have a questions and answer session where the listeners will really want to participate, but we are fully conscious that you have duty to attend to soon after our session. I think with that introduction, Dr. Rick, you're welcome to take us on. Thank you very much.
Thank you again, Dr. Christina Kadama. I want to appreciate you and the team at Purposeful Aging for thinking and considering and inviting me to talk to our parents. I know all of you seniors, Muri Murulengo Rabazadde baffe, and you are our parents, and so it's a pleasure to really talk to you, our parents. I will try my best, and chatting before with my colleague and classmate, Dr. Philippa, we're agreeing that we need to try and reduce Oluzungu, Olusawo in our conversation this morning. So I'll do my best to reduce Oluzungu. And just before I start, get deep into the conversation, maybe for the purpose of people putting face to and name, comparing the two, I will just put on my video for just less than a minute. And let's see, I hope that am I being seen? Can you see my face? Yes.
Yes,
So
we can.
So this is how Ricky looks like sometimes.
Thank you.
I have been ably introduced, and so I'll get into our talk this morning. And for sure, after I don't being having had the opportunity to teach and lecture, I know that our concentration for most of us does not go. If you talk for more than 30 minutes, 40 minutes, you will lose people's concentration. So I will not take too long, but I would stay on to have a moment of maybe questions and maybe addition supplements, so that our interaction becomes even richer. Now, talking about common ENT conditions that affect aging adults, I had requested my dear colleague, Dr. Philippa, to help me share the slides, and also even for future records, Dr. Christina Kadama will have a copy of my presentation. It can be shared to all members even after this, especially for those that have not attended our discussion this morning. And so, Dr. Philippa, whenever you can, if you can share some slides as I continue talking. As a way of introduction, paying attention to ENT wellness is key to maintaining independence, communication, and quality of life. I repeat, paying attention to ENT wellness is key to maintaining independence, communication, and quality of life. In our talk this morning, we will address the following issues very briefly for the time that we have. We'll talk about age-related hearing loss, which we call presbycusis in the medical language. We'll talk about rhinosinusitis, and we'll then talk about tinnitus or ringing in our ears. We'll talk about balance disorders and dizziness. We'll talk briefly about voice and swallowing changes, decline in sense of smell, a dry mouth, and the gums receding, and what that means to us as we age. Now, presbycusis, as we know it, is age-related hearing loss. We know that there can be various causes of hearing loss. I mean, starting from simple things as wax impaction, but we also know that as we age, as our bodies age, the nerves, the muscles, basically the body wears out, and the different parts of the body wear out. And so the nerve for hearing, in the medical language, we call it the vestibulocochlear nerve, but that nerve begins also, and the hair cells related to it begin to reduce in strength. Just like in old age, we realize that also our sight begins to change a bit, to reduce a bit. And sometimes if you want to read your newspapers, to read your Bible, you might need some eyeglasses to help you to improve on your sight. The same happens for hearing. And we know that the rate of hearing impairment increases with age. It can result from changes in the inner hair cell, in the inner ear, or from years of exposure to loud noises. And this would apply for people who, because of their work life, probably were exposed to loud noise in factories. Sometimes as young people, we abuse the sound in the sense of using earphones with very loud music. When that happens over years, then we get the effects in old age. Research has shown that over 1/4 of people aged 65 years and older have hearing impairment. And by the time we get to 75, 1/3 of us will show some signs of hearing impairment. Can you imagine that a third of those, our seniors who are 75 and above, a third of them have challenges with hearing? And we know that hearing impairment can alter a person's ability to understand speech. When that happens over time, their cognitive ability declines. The ability to think, the ability to reason begins to reduce. There's increased risk of dementia. Research has also shown that because of hearing, reduced hearing in old age, there is a bit of social isolation and depression because someone gets tired of us.
Hello? Dr. Ricky? Hello, doctor, we have lost you.
Sorry, someone tried to call me, but I switched them off. Am I on now? Are you able to hear me?
Yes, you're on. Thank you.
Yes. My apologies. Someone tried to call me through. But yes, so because of hearing loss in old age, again, we have challenges with reduced activity and also increased risks of falls. You know, if you are driving, for example, because I expect that even in your 60s, 70s, you should be able to drive. But if you can't hear other people hooting, or sometimes that can affect even your ability to drive. So no more life becomes hampered in a way. And yet we also know recently there was a landmark research published in the Lancet that showed that older adults at an increased risk of cognitive decline, a comprehensive hearing intervention slowed the loss of thinking and memory abilities by a remarkable 48% over a 3-year-old period. What this means is that for those in their 70s and 80s, if they have at risk of hearing loss, or if they have hearing loss, if you do something about improving this hearing, then you actually delay the onset of things like dementia, right? And later on, we'll just talk about what can be done. If I find that I'm not hearing very well, I keep asking for pardon, what can be done about my hearing? We'll talk about it later. Now, let's also talk about the sinuses. Now, I find it interesting in my clinic when I'm doing outpatient clinics that people come in sometimes and they say, when you ask, so how can I help you? What's troubling you? And they say, doctor, I have sinuses. And sometimes I just smile back at them and I tell them, I also have sinuses. All of us have sinuses. What do you mean? And of course, then they will explain, or you'll ask more leading questions, and then it turns out that probably they will have issues with their sinuses or they have allergies. But for this meeting, it's important to know that we all have air spaces in our skull bone. We have air spaces in our skull bone, and those air spaces are what we call sinuses. Mu Luganda kye kiwanga. The Bachiga Banyankole call them ebisheshenku. Now, pardon my limitation of other languages. I don't know what it's called in other languages, but yeah. So we have air spaces in the forehead. Those are the frontal sinuses. We have air spaces between the eyes. We call them the ethmoid sinuses. We have air spaces below the eyes, the chicomaxillary sinuses, and then behind the eyes, the sphenoid sinuses. So suffice to say that all of us have sinuses, ekiwanga. And these sinuses, like any body part, can actually get into trouble. And one of the commonest troubles, Dr. Kadama alluded to it earlier in our introduction, are these common colds, the flus and coughs. So you see, we know that when someone gets a cold, senyiga, flu, the first 3 to 5 days, usually the mucus is colorless or white. And the cause could be either a viral infection, Vazukulu came from school and brought you something, or you have a bit of allergies, and so they are causing a bit of trouble in your nose and sinuses. However, if this congestion in your sinuses, if this the discharge, the mucus takes more than 7 days, then there's a risk that bacteria will start working on this mucus, working in your sinuses, and then you begin to have yellow discharge, yellow mucus. So the moment you see mucus, the moment you blow your nose and through the day, and the mucus is yellow or greenish sometimes, then chances are likely you have what we call superimposed bacterial infection. Now, how do you know that your sinuses are in trouble? One, you feel congested in your nose. You feel facial pressure. And characteristically, that pressure, when you're feeling pressure or headache, when you try to bend forward, as if to pick something, that pressure or headache worsens, it increases. Okay? You will feel fatigued. And also the other thing I've not put in the slide here, which I mentioned, is the color of the mucus changes from colorless to yellow, sometimes green. It is thick, and sometimes it may even have a smell. It may not smell good. Then if that's happening, you know that probably you have a sinus infection. Now, although the heading there is chronic sinusitis, usually we call it chronic if it has been going on and on and on for 6 to 8 weeks. But in the first few days, a week or 2, 3 weeks, it's really an acute rhinosinusitis. And so sinus issues can become more common as you age because the tissues in the nose and the sinuses may become drier as we age or even more easily irritated. And that can lead to the congestion and pressure and more frequent infections. Let's talk about, and later on, as I said, we'll talk about the remedies and what we can do at the end after mentioning all these conditions. Let's talk about ringing in the ears. Again, once in a while, I see seniors coming in for reviewing my clinics, and they just simply say, doctor, there's noise in my ears, there's ringing in my ears, I can't sleep, or it's unbearable when I'm in a quiet room. We know that as our bodies age, remember we talked about the nerves becoming weaker. So the apparatus for hearing and balance, the ears, and I should have mentioned that our ears help us to do two things. They help us to hear, but also our ears help us with a sense of balance. Okay, if you remember from long time ago, I mean long time ago for you, our seniors in biology of the ear, we used to talk about the semicircular canals. So there are structures in the ear that help us with a sense of balance. But anyway, as our bodies age, the hair cells in the ear will also begin to weaken, and then you might begin to hear ringing noises. We call it tinnitus in the ears, which is more significant or pronounced when you are in a quiet room. For example, when you go to bed and everything is quiet, at night when you're going to sleep, you might hear the noise a little more than in the noisy environment, because the noise during the day, the background noise that you hear from cars, from people, from birds, it masks what you should be hearing from your head inside your ears. And so you may not hear it during the daytime. But also we know that abnormal noise in the ears can be because of increased wax, ear wax. Now, I find people who use a lot of earbuds to clean their ears, and you know what? They say my ears are dirty. Some of them will come to you and say, "Doctor, my ears are dirty." I say, "What's making them dirty?" They say, "There's a lot of wax," and I have to labor to tell people that that ear wax is not dirt. That earwax is God's way of protecting your ear canal, of protecting your eardrum. So wax has two functions. Wax, we also in the medical language we call it cerumen, but just call it wax. Now, this wax helps us to do two things. One, it traps dust and prevents it from accumulating in your ear and getting to your eardrum. Number two, wax is an antiseptic. Wax can kill some bacteria. So wax is good in our ears. And so after having these conversations with my clients, then they will ask you, "But doctor, how do I clean my ears?" And as if I've not just told them that wax is good in our ears. But anyway, if you must clean, because naturally, as wax gets old and loses its function, it will flow outwards. So if you see people who have not cleaned their ears in like months and months, you might see wax actually beginning to pop out of their ears. And so people don't want that. So I tell people, if you must clean, when you're bathing, get a towel, put it on your finger. And then, sorry again, I hope I'm still clear. Someone tried to call me. My apologies. I hope I'm still on. But yeah, so use a towel on your finger and clean your ear. And wherever the finger reaches, that's enough. Beyond where the finger reaches, leave that wax alone. It is doing a good job. Now, then you'll ask, but sometimes we get too much wax. Yes, it's true. And the illustration I can give is that we know that it is normal to sweat, right? Every one of us sweats. But there are people who sweat a lot more than others. And yet it is normal. As long as they are not diseased, they don't have a fever, they are not diseased, it's normal for people to sweat a lot. All right? So in the same way, there are people who produce a lot more wax in their ears. And when that happens, and it kind of gives that feeling of blockage, it gives a bit of noise, a buzzing noise, come into a doctor. Even your medical officer should be comfortable enough to wash out that wax, a process called ear syringing. So we know that if wax is too much, it can be cleaned out, right? Now, in the process of aging, we know that the skin in the ear that's supposed to help us to produce wax sometimes produces hard wax instead of soft wax. So if that happens, and instead of the wax easily coming out, it easily fills up and blocks your hearing, go in and see your doctor. Let it be cleaned out. Let's talk about balance. Remember, I mentioned that our ears have two functions. Our ears help us to hear, but also they play an important role in contributing to your balance system. Now, let me digress a little bit. In order for you to balance well, there are three systems in your body that are important for that function. One, I've just mentioned the ear. In the inner ear, we have the semicircular canals, and we have in the cochlea we have what we call the endolymphatic sac. So those help us with a sense of balance. That's why the hearing nerve is called the vestibulocochlear nerve. It has the vestibular part for balance, the cochlear part for hearing. Anyway, the second part that helps us with a sense of balance is the part of the brain, the hindbrain, called the cerebellum. Never mind those scientific words, but is that part called the cerebellum that helps us with sense of balance. Then the joints, the major joints of our body, the joints of the backbone, the joints of the shoulder and the hip bone, they help us with a sense of balance. What we call proprioception. Again, never mind that scientific word, but just know they help us with balance. So if something goes wrong in any of those three body parts, the inner ear, the hind part of your brain, or the joints of your backbone, you could get a sense of imbalance, of dizziness, kamunguluze. But that dizziness that happens because of ear problems is uniquely different from the dizziness that happens because of the brain problem or the backbone, the joints. The one that comes from ear problems causes a sense of rotation. You see the room, when it happens, you see the room spinning. You lie on a bed and the whole room is spinning, and usually you are nauseated, you want to vomit. Sometimes it may even come with ringing noise, with the reduced hearing. So it's quite clear, even before we do any major investigations, if you come in with dizziness and we're able to tell that there's what we call vertigo, that sense of rotation, we know that your ears are in trouble, and that can be corrected. So I just wanted to say that in old age, sometimes we may struggle with dizziness, with balance issues. What about our voices? Now, again, remember we mentioned that as we age, our muscles will weaken a bit. So muscle weakness and reduced elasticity of the vocal cords or the throat can lead to some level of hoarseness of voice, or sakala. Some people, even the voice becomes less than what it used to be or disappears, okay, or reduces in tone. So yes, that can be because of muscle weakness. Also, we know that the tissues in the voice box, the voice box in the medical language we'll call it the larynx, but the tissues in the voice box stiffen, they become stiffer, zikakanyara. So when they become stiffer, the pitch and quality of your voice may also change a bit. And when that changes, it may lead to a little bit of hoarseness of voice. We also know that when the muscles have weakened, remember, how are you able to swallow food? When you have chewed food, when you're going to swallow, the muscles in the throat, in the food pipe, the esophagus, have to contract and push the bolus and push the food downwards. They contract and push it downwards. So that contraction, if it weakens a bit, if the muscles are not strong enough, then that means that they're not pushing the food bolus down enough. And what happens? Sometimes food may get stuck in your throat, and when it gets stuck in your throat, it may choke you. You may start coughing while you are eating, or you cough when you are drinking because the food or the drinks have gone in the wrong way. For some people, as we age, that can happen. And when this persists, the choking, it's not good, because with time, it can cause infections, because you see, these food particles are not supposed to be in your airway. When they keep leaking, or even the fluids, and go down into your windpipe, in the windpipe, into your lungs, you can actually get a pneumonia, an infection of the lungs. Let's talk about the sense of smell. Again, aging, the nerves for the sense of smell may weaken with time. It's not a must, by the way. All the things we are mentioning will not happen to everyone, but we are saying it can happen because of aging, because the muscles, the muscle cells, the cells that help us, the nerve cells that help us with the sense of smell, and all these other functions begin to reduce in strength. And when that happens, your sense of smell may reduce a little. The lining of the nose becomes thinner as we age and drier. The nerve ends deteriorate. And so the decline in the sense of smell might also affect the sense of taste. And an example I give here is, commonly we know, you might have experienced it, that when you have like heavy flu, when your nose is quite blocked and your sense of smell seems to be reduced or it goes away because of the flu, have you realized that also your taste reduces? Your sense of taste reduces.
Yes.
But let me even remind you, in the recent past, a few years ago when we had COVID, did you realize that some people lost their sense of smell for a short time? And when they did, if you remember, if you ever lost your sense of smell, even your sense of taste either reduced at that time or completely disappeared, but then later it was restored. In fact, we wrote a paper, I and a group of other colleagues, we did some research amongst COVID patients here in Mulago and Chilud at that time during COVID, and actually published, and we found that many of our patients lost their sense of smell for a short time, and of course, equally, that went with a sense of taste, but that was restored. But anyway, just to note that when the sense of smell reduces, even the sense of taste will reduce. And in old age, when that happens, then you lose appetite for food, because why do we eat food? Why do we, for example, like roasted fish or whatever? Okay, I'll not mention some meats here. For reasons best known to everyone. But why do we like some of those special meats? Because of the scent, because of the aroma, because of how they taste on our tongue. And so, if you lose the sense of taste because your sense of smell went or reduced, even your appetite goes down for certain foods, and we need to watch out for that. We need to watch out for that as we age. But also related to that, talking about smell and taste and the mouth, is that as we grow older, our salivary glands reduce in the amount of saliva that they produce. So as we grow older, these glands, we have saliva, we have glands that help us produce saliva. Have you ever seen children with mumps? Amamburuga. When someone has mumps, it is the parotid glands. Those are salivary glands that help us produce saliva. But we also have other major glands. We have the submandibular below the chin and the sublingual. Now, as we age, these glands also reduce the amount of saliva they produce for us. And when that happens, then there is a possibility of getting a dry mouth. And that also leads to a cascade of things. When you have a dry mouth, then it means that, one, your sense of taste, because in order for you to taste something, it has to mix with saliva. And then it gets to the taste buds on your tongue and in the lips and in the gums. So if there is less saliva, less ability to taste foods, and then again, that leads to the reduced appetite. But also, less saliva, as we shall later see, can lead to possibility of infections coming in the mouth. Because saliva is protective. Actually, it's not just for lubrication. It also has some enzymes in it which help us with the digestion of food. Saliva also has some antiseptic effect. It fights some bacteria. So when the saliva glands reduce the amount of saliva they produce, it is a big disadvantage. Finally, the other thing that I thought about that happens in the ENT system, because as we age, is that as we grow older, the gums begin to recede. Now, the gums are so you see where the teeth insert, where the teeth attach. Those are the gums, the jaws, in other words. So the gums begin to recede, and consequently, the lower parts of the teeth begin to get exposed. They get exposed to food particles, to germs and bacteria, and also the enamel, the covering, that white covering of the tooth. You know, that's that's very hard structure that protects the inner part of the tooth. It also begins to wear away. When all these changes happen, together with a dry mouth, then your teeth begin to become susceptible or exposed to bacteria, you get exposed to getting cavities, decay and cavities in those teeth. And with time, unfortunately for some people, if those cavities are not taken care of, then you begin to, the teeth will either fall out or be worn out, so that when you go to the dentist, by the time you go to the dentist, they say, no, this tooth cannot be repaired. It has to be removed. Now, I must be getting close to my conclusion. How do we manage all these challenges that we have talked about? I want to just briefly mention a few things we can do as we age purposefully. How can we maintain a healthy ear, nose, and throat system? Or even when it is getting affected, how can we see that we take good care of it to enjoy our old age? One is, if you begin to feel that your hearing has reduced, and how do you tell? If you realize that you have to ask for pardon, maybe you are in a meeting and you feel you can't hear some people well, or you're talking, your bazukuru, your grandchildren are visiting you and you can't hear what they're telling you very well, you keep asking for pardon. Or you're seated in the sitting room and as you're watching TV or listening to your radio, the people around you tell you, but Jaja, the volume of the TV is too high. And for you think, this was normal. When that begins to happen, you need an ear check. Don't complain and say, you are stubborn. Why? No, please take it in good faith. Go and have an ear check. And these ear checks, the hearing tests, and especially after 60, please do have them. They are not expensive. And then now in Kampala, we have a number of places where you can have your hearing tested, so that if something has really drastically gone wrong, it can be repaired. Remember, we mentioned earlier that when your hearing is affected, somehow your cognition, your ability to reason, your ability to think is also reduced. You begin to feel socially unacceptable because you are always asking for pardon. You're not hearing what people are saying. So it can affect you emotionally. So when you begin to feel your hearing is not good, go and take care of it so that you enjoy a good old age. Now, if you haven't gotten any challenges with hearing, please protect your ears. Please protect from loud noise. Our seniors, our parents, when you go to church, to mosques, or to these functions, these weddings, now I know you are having many weddings and graduations for your children and bazukuru. Please keep away from loudspeakers. Do not sit near a loudspeaker. Most of the people managing the loudspeakers are young people. And you know what we young people enjoy, eh? For them, music is not music if it's not very loud, eh? So, for you, protect your ears, keep away from those loudspeakers. And sometimes, there's this background, like when someone is speaking from a microphone and then somehow they face a loudspeaker, it makes that high pitch. That one is bad for your the hearing nerve. So when you sit in these meetings, when you sit in these churches or functions, just sit away from loudspeakers to protect your ears. I mentioned earlier on people who use earbuds, also called Q-tips. We also call them the cotton buds. Please avoid them. Avoid them. And of course, someone one time challenged me, and I see this actually not even one time. A number of times people say, but why do they sell Q-tips? Why do they sell these cotton buds in the supermarkets and pharmacies? And I say, well, they are playing on your ignorance. And I know that sometimes those earbuds can be helpful. But that's very rare. For example, if you have an ear infection and there's pus coming from the ear, I would advise that, yes, when you're at home, use a cotton bud gently to suck out the pus and then put the medicine, the eardrop. But generally speaking, for cleaning your ears, keep away from earbuds, please. Sometimes these earbuds, when in trying to use them, they'll just push the wax further, deeper into the ear. And when you push the wax deeper into the ear, then your hearing will reduce. Then you'll have to come to me, an ENT or your GP, and we'll have to do ear syringing. Now, a box of earbuds is about how much? Maybe about what, 10,000 or something? But I will tell you this, the cost of seeing an ENT or your GP and the cost of hearing, of ear syringing, hey, you'll easily pay like 100,000 or like a 150, and that's like 10, 15 times the cost of these earbuds. Keep away, our seniors, keep away from these earbuds. They're not good for you. What about nasal and sinus health? Now, remember, we say that as we age, the nasal mucosa becomes drier, the mouth becomes dry, the salivary glands are not producing enough saliva. I want to advise us and encourage us to drink a lot of water. Make it a practice. We also know that as we age, actually I read it somewhere, I don't remember where, that after 50, our thirst glands, not the thirst glands, sorry, the sensors of thirst in your brain begin to reduce. And therefore, after 50, the tendency to feel thirsty reduces. And yet the body still needs water. Remember, we from our biology, primary biology, we've been taught that our body is 70% composed of water. Can you imagine? 70% of you is fluid or water. So if you deprive the body of enough water, you get dehydrated, the salivary glands don't have enough water to make saliva, you have trouble in your mouth. So make it a habit. In fact, I find pleasure and seeing seniors who come in to see me, and they come with their drinking bottle. Make it a habit to move around with your drinking bottle and drink warm water through the day. Warm water through the day. If you can do like a liter, 1.5 liters, of course, we also factor in the soup in your food, the tea that you take. But I know that, none of you will take soup, which is like 1/2 liter banangi in your sauce. So please compensate by drinking water, adequate water through the day. Avoid cigarette smoking and strong odors. Some of these irritate the mucus glands in your nose and what we call the mucosa, and that will further cause irritations in your nose and sinuses. And when you have to blow your nose, just blow gently. Don't do it forcefully so that you don't hurt, the skin inside the nose. Allow me to call it the skin, but that pink lining inside your nose and sinuses is gentle, it's fragile. So when you blow too much, with the time you'll see streaks of blood in the mucus and you wonder, is there a problem? Then you start panicking. But now I have blood in my mucus. And yet it was just that your mucosa or the skin inside there is fragile, but when you blow too much, it tears and you bleed. If you feel your nose is so congested or dry, you can visit your GP, general practitioner, the one who sees you, usually your physician or even an ENT, and they'll be able to prescribe some saline drops. Now, saline is not a magic thing. Saline is simply salt and water. When you buy a bottle of saline at 5,000, that one that has like just 20 mils, they have sold you salt and water. This salt and water is very important to help and lubricate your nose and keep it moist. If you have allergies, come see your doctor and treat those allergies. What about dizziness and balance issues? Now, we have said that this is a likelihood in old age. It's not a must for everyone, but for a fact, when you have issues with imbalance, because this can affect your motion, it can affect your movements. You don't want to be walking in town and they see you staggering as if you are drunk and you have not drunk any alcoholic beverages or even falls. So when you realize that you're having a bit of imbalance or vertigo, as we call it in the medical language, come see your doctor. If your doctor if the GP cannot make sense of what's happening, they will either refer you to us, the ENTs, hoping that it's an ENT problem, or to an orthopedic surgeon to look at your spine, or even to a neurophysician to consider issues with your brain. Neurophysician or even a neurosurgeon, any of them can see you to help. But visit your doctor. If your voice is a bit hoarse or becomes hoarse or weak, please, again, if that lasts for more than 2 weeks, because if it's minor, you'll have a bit of hoarseness. Maybe you had a flu, a cough, a sore throat, and that may last a few days to a week or two. But if it exceeds more than 2 weeks, please come see your doctor, because we know that there are other sinister causes of hoarseness of voice. I don't want to threaten you to make you afraid, but there are others. And so if you have hoarseness of voice for more than 2 weeks, please visit your doctor or visit your ENT. Let them check it out to rule out other bad causes like cancers of the throat. But please note, if it's just taken, if the hoarseness is on and off and happens a week or two and goes away, don't be too worried. Just sort it out, treat the cause, don't be too worried. Right? And finally, visit your dentist. Visit your dentist. My friends, I don't know how much importance I should attach to this, but our teeth, imagine at 60 how many years your teeth have been working. Imagine at 75 how many years your teeth have been working. They need help, Vanange. You know, some of us pride, some people pride and say, for me, my teeth are okay. I've never visited a dentist all my life. Bambi, go for just a wellness check. A wellness check to see, because some cavities grow and polar little, slowly without you knowing, and they may not cause pain all the time. And then by the time you go to the doctor, they say, hey, where have you been, sir or madam? Your tooth is wasted beyond, you know. And sometimes, you know what? Sometimes when these teeth are decaying and they begin to have cavities in them, they begin to give you a smelling mouth. You begin to have a bad odor, what we call halitosis in the medical language. You begin to speak and your mouth, the smell coming from the mouth is not good. So if you have a bad smell, first go and visit your dentist, right? So in summary, friends, you might notice that hearing conversations in noisy places becomes harder, or that your balance feels less steady than it used to. Perhaps you have experienced more frequent sinus issues, or find that swallowing certain foods takes a little more effort than usual, than used to before. This can affect how you interact with others, how safely you move through your day, and how much you enjoy the activities, the usual activities like dining with others, spending time with family. If you have such issues, please go have a check with your GP. You can start with a general practitioner, and when they are good enough, they'll realize their limits. If they find that they realize their limitations, if they can't help you, then they send you to an ENT or a physician to help you. Have regular general checkups, friends. I want to thank you for listening to me. And now we can have, maybe, if time allows, some questions and answers, and even additions. Thank you very much.
Wow. Thank you so much, Dr. Ricky. It's been like you are in our houses every day. You are talking to many of us, but it seems you are just visiting our homes. We suffer from all of these things in one way or another. And I'm so happy that you put it in a language which all of us, and especially our caregivers, can understand. I just wanted to add on that when the old person has put on loud noise, radio, TV, and you shout at them, then they go into the next phase where they are, I think, completely deaf, and they seem like they are not with you. It seems beulira, like they've cocooned themselves. They are no longer responding, but actually they have lost most of that hearing. And for the caregivers, don't get annoyed, don't get irritated that the old person is not hearing you, is not responding to you. They have not heard you. They have lost it all. Thank you so much. And I want to ask Dr. Philippa to manage this next session with the time constraint at the back of her mind.
All right, thank you very much. Ricky, thank you for bringing it home for us and making this very real, these changes very real. We could all relate with what you said. I'll start by asking the question that is there in the chat, and also people feel free to put up your hands. The first question, before I take Nancy's question, is what causes accumulated mucus in the throat? Ricky, that's for you. But before you answer it, let me allow Nancy to unmute and voice over so that you take those two questions together. Nancy?
Thank you very much, Dr. Philippa. I have been a user of cotton buds, and he says cotton buds are very bad. And now I'm wondering, I thought they are cleaning to an extent. How do they damage?
Yes, thank you for that, Nancy. Ricky, over to you to handle the question about cotton buds and the cause of accumulated mucus in the throat.
Thank you. Thank you for those questions, and thank you, Dr. Kadama, Christian, and Dr. Philippa for the appreciation. The accumulated mucus in the throat. Now, again, remember the aging process. The mucus glands easily get irritated, and normally we have mucus glands in the mouth, in the throat, and they produce little mucus just for lubrication, so that when you're swallowing, food goes down smoothly. But as we age, two things begin to happen. One, your mucus glands can easily get irritated, and when they get irritated, they produce a little more mucus than usual. Number two, because of the aging process, the mucus produced is thicker. It's less running, in other words. So when it becomes thicker, it easily plasters in your throat, and you feel like you want to clear something from your throat. It's really irritated mucus glands in your throat. And usually if you try to clear, there is little mucus that comes out, but when it comes out, most times it is white or colorless. That's okay. Just be encouraged to drink a lot more water. But if you begin to clear and the mucus coming out is yellow all the time through the day, that one you need help. Visit your GP, visit your physician, visit your ENT to get help with that, to get it checked out. Now, cotton buds. I was actually smiling, Nancy, when you're asking that question, because I hear it so often in when I'm running, just taking care of my patients, running the clinics. Because we've been taught, even mothers, and I know you jaja mamas, when your was could come, say, Jangu, come, let me clean your ears are dirty. And because it's something that we do so routinely. But please remember, Nancy and everyone listening, that wax in our ears is good. It helps us, like I mentioned earlier, to trap dust and insects and prevent it from getting to your eardrum. Because when you look in, there's that white membrane in there, the eardrum. It's very thin, very fragile. You don't want it damaged by these things. But number two, wax is an antiseptic. It kills bacteria. It is good for your ear. Now, like I mentioned earlier, it is true that as wax gets old, if you have not been cleaning for a while, it begins to flow outwards. So if you see people like in the villages there who don't have your, the earbuds. The earbuds are, allow me to say an interesting Luganda word, kajanja kabasomye, kajanja. What is the word for kajanja in English, Philippa? Your English is better than mine. But, it is, I think the word is wise. Okay. It's, it's something we the land use, but the people in the villages, they don't have, can they even afford the cotton buds? They don't want to use, they don't know them. And so if you look at them, you might see that wax is beginning to flow outwards because it's lost its function. So normally I tell people, get a towel, use a towel on your finger and clean your ear. Beyond where your finger reaches, leave it alone. Now, just to discourage you, Madam Nancy, I have seen different complications of earbud usage. And let me just briefly mention like 2 or 3. One, as you're trying to use this earbud, sometimes the bud is just fitting in the canal, so it just pushes the wax deeper. And so when the wax goes deeper and sits on your eardrum, your hearing will reduce. I will tell you almost on a weekly basis, because my clinics are quite busy, I see 1 or 2 patients whose wax has impacted because they were trying to use an earbud to clean. Number 2, the skin in the ear is fragile. It's white or pink. As you use this earbud, even when you are gentle, sometimes you irritate the skin, and with time you get bacteria there. And my friend, when you get an ear infection, it is very painful. Ask someone who ever got an ear infection. Very, very painful. And earbuds are some. They're not the only cause, but they're some of the causes. Finally, I have seen people coming from having had accidents with earbuds. A mother came in and with an earbud stuck in her ear, and the eardrum had been perforated. How? She was cleaning her own ear, and her baby came and jumped on her, pushed the hand in, and the hand pushed the earbud into the eardrum. The eardrum was ruptured completely. You know what that one needs? That one would need repair of the eardrum. It's a surgical procedure done under general anesthesia. It will not cost you less than 3-4 million from a cotton bud of 1,000 shillings. I have seen, you know, that children, I can talk on and on, but let me just give this last one. Children learn from us as adults. You know, they see mommy and dad as their heroes. So when they see mommy cleaning their ears, they think it's a good idea. I will tell you for a fact, I've seen children coming in the clinics, and what do their parents report? The sister, the other brother was trying to clean her ears with an earbud and pushed it in deep and injured the child's ear, because they don't know how deep the ear canal is. So for them, they saw dad and mommy use it, so they think it's okay. So they also practice on fellow children. But now, keep away from earbuds. I can't overemphasize it enough. Thank you.
Right, Ricky, before we leave the discussion on earbuds, there's some comment in the chat following on that. Normally the urge to use cotton buds is because the ears get itchy. What causes the itching, and what can we use to get relief from the itching since we can't use the earbuds?
That's a very good question. So itching in the ears can be caused by various things. One, you might have itching in the ears because you have allergies. You know, what does allergy mean? When someone has allergy, it means that their body is reacting to certain things in the environment. It's generally a genetic thing. Allergies run in families, although they will not attack everyone in the family. But basically, it means that whenever you're exposed maybe to too much dust, maybe to strong perfumes or sprays, for some people, they are oversensitive to even coldness. Some of those things irritate you. And when they irritate you, they cause either itching in the ears or the eyes, or itching of the nose, sneezing, or kwasmura, kwetiamura. Okay. So when that happens, then treat the cause. But also when the itch, I know for a fact that when the itch comes, it's hard to avoid it. Use a finger. Use a finger without I hope your fingernails will not be long. Use a finger to just rub on the ear, but don't put things in there. Now, so allergies can cause that. We also know that in old age, the dryness of the skin can cause itching. The skin in the ear can cause itching. But we also know that itching can be caused by fungal infections in the ear. And when that happens, the itching is worse when you have bathed. So water enters there and irritates you, and the itching is worse. When the ear is a bit drier, the itching is less. So if the itching is persistent, go to your GP, go to your doctor, your ENT, let them look in. If it's a fungal infection, it can easily be treated. I know fungal infections are stubborn, but they can be treated and they can be cured. If it's allergies, avoid the exposures, the allergens, the things that irritate you. There are good anti-allergen medications that we can give to deal with that itching. Thank you.
All right, thank you, Ricky.
Sorry, Dr. Ricky. Sorry, I just asked because it was related to this. Sometimes the finger doesn't reach there and you feel this irritation. So I don't know, what do you try out if the finger and you feel the irritation is there, or maybe the wax is there but it's not reaching there? Is that the time when we now have to maybe go to a health, or we totally avoid those swabs? What do we do? Thank you, sir.
Thank you for that question. Yes, I agree that sometimes can be really, really tough. If it's persistent over days and the itching is too much, please go and see a doctor. It's something else that's happening. Chances are yes, it might be allergies, and a simple anti-allergen remedy. I mean, we know the antihistamines on the market, very easy drugs to access, would help take care of that itching if you have allergies. But if it's persistent and it's too bad, please go see a doctor, because it could be a fungal infection and that will need to be treated. But others, keep away from earbuds, use a finger. If the finger is not helping take away the itch, go see a doctor. That's the time to go and see a doctor.
All right, thank you. Can I ask Dr. Jane KK to unmute and voice over?
Hello, thank you very much, Dr. Ricky, for this presentation. I just want to share an experience that landed me in emergency twice, completely out of ignorance. So I live with a gastric problem. So I'm one of those who have acid and this, that. So most of my life I have been using these Andrews and liver salt and all these things which they say relieve acid. But actually they contain a lot of salt. In fact, most of these antacids, they are sodium something. And I wasn't aware. So twice I ended up in a Nakasero emergency. Then they can't find what's wrong. They dizzy. And now I have like tinnitus, but over a long period of using these salt-containing antacids. So Dr. Rick, you might wish to start really looking into that, because a lot of us are using them for indigestion, for whatever, and yet they are really, really terrible because of that sodium. When I discovered the trigger, now I don't get the problem anymore. But I was so surprised that for all my life, I didn't know that I was harming myself, and harming myself in a completely distant part from the part I was trying to remedy. Just wanted to share.
Thank you, Dr. Jane. That's very helpful. It's actually another angle I can look at when patients, especially the seniors, come complaining of tinnitus. That's a good one. Thank you.
All right, so Ricky, I'll just read a few more questions for you. What causes bleeding through the nostrils? And then you had some thank you notes, and also a question about, can these ENT changes occur in younger people as well? And also a question about, we handled that one. There was a question about how can we slow some of these effects that you've talked about. Is it through exercise, types of food, any practices other than that, any other practices and supplements? Are those possibilities to use to slow some of these effects that you've talked about? You could handle those 3 questions, and then we'll get another set before we close.
All right. Thank you, Dr. Philippa. Bleeding from the nostrils, the commonest cause of bleeding. Now, the nose is very well supplied with blood vessels. In fact, for the medical people, we know, we remember what a plexus is. A plexus is a combination, many blood vessels, either veins or arteries, coming together to form like a network. So we have 2 plexi or plexuses, if I may call it, in the nose. And so the nose is very well supplied in terms of blood. Now, and so because of that, definitely there are possibilities that one can bleed from the nose especially if there's trauma. We know that the commonest cause of nosebleeds in children is nose picking, trying to remove booger from their noses and cleaning. It can cause that. But we also know that if you've had a nasal and sinus infection, flu, senyiga, the mucous membrane, the skin inside there becomes weaker because of this inflammation, the reactions going on because of the infection, and it can easily tear as you are blowing your nose and cause bleeding. But in old age, beside the sinus infections, the possibilities, also the dryness of the nasal mucosa, the skin lining inside the nose, when it dries excessively, it can crack and cause bleeding. Of course, there are other sinister things which I don't want to go too much into. But if someone has a tumor in the nose or in their sinuses, you could also have bleeding. But that usually will come with other symptoms, nasal blockage and maybe loss of sense of smell, difficulty in breathing. So those come with many other things, and you can easily tell. But bleeding from the nose, in our lifetime, almost every one of us will have an episode. If it happens, do not worry too much. If the bleeding is not torrential, pinch the nose, bend forward about 4-5 minutes while breathing through the mouth, the bleeding will stop, usually. Okay. Can these ENT changes occur in young people? Most definitely, because I usually tell people that as long as you have an ear and a nose and a throat that are functional, that have a good blood supply, they're alive, they can get sick at any one point from many of these. So all the things we talked about that can happen in old age, yes, for many other reasons they can happen also in young people, and we have remedies, different remedies, of course, on how to deal with those changes if they happen. How can we slow some of these changes? Before you get there, if I know there are people who are not yet seniors in terms of age, 60, who are not yet 60 and above, before you get there, regular exercises. If you do regular exercise, and regular exercise does not mean going to the gym necessarily. I mean, that's part of it if you want to, if you have the time and the resources. But regular exercise can be exercises like walking, brisk walking, running for those of you who can, bicycle riding, swimming. Some of these help to keep your muscle tone good. And that can help you with the muscle tone and issues, preventing imbalance coming in later in old age. The food we eat, nutritious food, cutting down on weight gain, because again, all these may have some minor effects. But again, we know that in old age, there are certain diseases that just come in. Diabetes, hypertension, and either the disease process, I mean, like diabetes will affect the small blood vessels supplying these nerve endings, and that's why I mean the physicians here will tell us that possibly that's why people have paresthesias, numbness or pricking pains in their feet, in their palms, but that can also affect the small blood vessels in the eyes, in the ears, and therefore cause effect to either your vision or your hearing. So some of the chronic diseases may come into effect. So when you control them very well, even hypertension, that will help to deter some of these changes. Someone asked about ringing in the ears. I think I saw a message. How do you reduce it or clear it? Now, ringing in the ears is also another big topic that we teach, especially to our postgraduates. It's another 1 hour, 1.5 hour lecture that we do. But suffice to say that, yes, ringing in the ear can happen. It might have different tones. It might be the high-pitched one. It might be like buzzing one, or like wind. So they have different causes. Sometimes it can be as simple as just wax, accumulated wax that can be cleaned out and it stops completely. It can be a foreign body in the ear. You are trying to clean your ear, the cotton bud gets stuck in the ear, and then you begin to hear that buzzing noise. When that is removed, you are sorted completely, it goes away. But sometimes, unfortunately, in old age, the ringing in the ear might be because of reduction of the ability or the function of the hair cells in your inner ear. And when that happens, unfortunately, it is irreversible. We can only do certain things to reduce the amount of noise that you're hearing, like having what we call tinnitus maskers. There are special hearing aids that you put on to mask the noise you're hearing so that you are comfortable. But if it's the ringing type and comes in old age, for some it's unreversible. Also, allow me to note that if that noise happens together with dizziness, there is a condition, again, which I may not go into details with. It's called Meniere's disease. Meniere's disease is an ear disease that causes vertigo, dizziness, causes reduced hearing, causes that abnormal ringing noise. When that happens, we can treat it and even the noise will go away. But so some things are avoidable, but also when some happen, we can't reverse them. I think that's what I would share.
Thank you so much, Ricky. We're coming to the end. Someone asks how often we should have a routine checkup. And also to add on that, maybe you can tell us a few places you mentioned that we can have hearing tests done. Maybe you can mention where we can get these services so that people can know about them.
All right. Okay. How often should we do routine checks? So generally, and I will address this mainly to parents here, the seniors. Generally speaking, if you have, for example, for ENT, I mean for your hearing, if you do a checkup, let's say now for the very first time in your life, and we find that your hearing is good, your nose and throat system is good, I would say if you don't get any serious trouble, check again in the next like 3-4 years. So you don't have to do this annually, no. But if we find out that you're already having trouble, say, with your hearing, maybe your sinuses are in trouble, then depending on the cause, you may need a bit of regular checkup. And remember, some are, because, for example, if you have a sinus infection, that's a one-off. It's not supposed to be an ongoing thing. We treat you. If infection clears, then you don't need to come in again for review to treat that problem. But for routine, maybe once every, let's say, 5 years, a routine ENT checkup would be good for you, just to know that all is well. And for seniors 70 and above, if you've never had an ENT check, maybe consider it. I know it might cost you some little money, a bit of consultation, a bit of hearing testing, but it might be to your great advantage if you listened in to the earlier conversations we had when I was presenting. Now, where can you do ear checkups? Now, the places that test for hearing, in Kampala, there is Bombo Road, there is a building called Esami. Now, there's a word they use, conflict of interest. Let me mention that I don't work at Esami, I don't work at that place. I'm going to tell you some of the places I mentioned. I work there, but I'm not the audiologist. I'm not the one who tests for hearing. But since it has been asked, I will mention. So on Bombo Road, there's a building called Esami. It's a blue building. It's opposite YMCA. If you know YMCA, opposite there are a number of buildings. Then there are 2 petrol stations. The building just before the petrol station is called Esami. On that building on the ground floor is an office called Kampala Audiology and Speech Center. Kampala Audiology and Speech Center. In that place, you can go and have your ears checked for hearing levels. IHK, CCare in Namuongo, they have an audiology unit. They can test for your hearing. And I think, well, in Mbarara, I know that if you are upcountry in Mbarara, the regional referral has hearing testing ability, can do that. There's another clinic called Atlas Atlas Clinic in Mbarara, opposite Bank of Uganda. They can do it. Now, I mentioned these places so that if you are upcountry, you can do hearing testing. Yeah, I think there might be other hospitals with hearing assessment ability, but I don't know. Mulago used to, but I don't want to say much about Mulago Banange, but I don't think the things are working. But anyway, I'm not a politician, so let me end there so that they don't think I'm politicizing the issue. But Mulago will not help you much. Yes.
Right. I will not continue with that comment, Ricky, on Mulago, but I'll just say thank you very much. I think we have many messages in the chat, people appreciating your talk. And just 2 last questions, I'd call them questions. One is, I think before you close, since earbuds were a very hot topic in this talk, and it's something we all experience, I'll just ask you to go over how you said we should clean our ears when we have that accumulation of wax, because we don't really want to go around having wax pouring out or looking like we have dirty ears, as much as it might be normal to have wax. So I'll just request you to go over that. I think it will help to address a concern that we've had in the chat. And also a last question, do ears produce normal natural sounds which go unnoticed except in a quiet environment? If you can address those two issues, please.
So, how do we clean our ears? So please note that our ears are clean, even with wax. But I know if I did not mention how you can remove wax, I will leave some people very unsatisfied. and I usually smile a lot about this when I'm talking to, when patients are before me and we're just conversing, talking about these earbuds. But please note that wax in your ears is good. It is normal. I will emphasize that wax will help to protect your eardrum from dust and insects. That's an antiseptic to kill some bacteria. But we know that wax can accumulate because it's being produced normally. By the way, the glands that produce wax in the ear, they are called ceruminous glands. So they are there. They are normal. Now, as wax grows old, it will flow outwards. And yes, it's true. Like Dr. Philippa said, we don't want to move around and people are looking at, and they are, we call it data in quotes. You have data ears. They will not even mention it to you, but they will think this person doesn't take good care of themselves. So to avoid that, I usually advise people, get your finger, put a towel to, like when you're bathing, get your finger, put a towel on it and clean in the ear canal and clean beyond where the finger reaches. Leave it alone. That wax beyond the finger is working. And since you have cleaned what is outside, no one will see that actually you are dirty. But as I said, sometimes there are people who produce a lot more wax than usual. When that happens, then how will you notice? It will block your hearing. You feel like you can't hear very well. In those instances, I know that you'll be tempted to use earbuds, so I cannot even tell you 100% stop, refrain from using them. But the proper way is go to your doctor. You don't even have to look for an ENT, because in medical school training, even a nurse, even a medical officer is trained how to clean your ears with ear syringing. Please don't allow people to put instruments in your ears. Bambi, don't allow instruments in your ears. Sijui to take out simanyi, the dirt, the wax. No, if they can't use water, leave, go away, say, doctor, it's okay. Go and look for an ENT to do the proper ear cleaning. And the proper ear cleaning is what we call ear syringing with lukewarm water. Sometimes if you find us in places with suction, we can even just suction it out of your ear. But yeah, I hope I've answered that. Then there was the last question, Philippa, you mentioned. Yes, that do ears produce normal natural sounds? No, they don't. If you hear noise in your ear, it is abnormal. You're not supposed to hear. They don't produce any natural sounds. No, none that we know of. At least none that I know of. Right. I think I've answered the questions, Dr. Philippa.
Yes, you have very well. Thank you very much. And I can't thank you enough for having done this session for us. And I'm sure, like the comments you've seen in the chat, people have learned a lot. And we shall be keeping all this in mind as we continue to age intentionally. Thank you very much again, Ricky. I'll hand back to the moderator to close this session.
And just a quick word. Again, I want to appreciate Dr. Christina Kadama and the team of Purposeful Aging. Thank you for considering and inviting me to speak to our parents. I am grateful for that opportunity.
Well, thank you so much, Dr. Philippa, for that Q&A session. I want to once again thank you, Dr. Ricky, for having accepted to come and for delivering the messages so well, so down to earth, and so very informative to all of us, medical and non-medical. We have really spent this hour very usefully. I just want to remind our dear viewers, participants, old adults, caregivers, always remember to walk with your bottle and sometimes with a warm fluid in it, not necessarily cold, and let that old lady or old man take sips now and then. Remember to visit your dentist. Remember to visit the ENT once in so many years. All of these things will help us to age purposefully. And on that note, to thank the younger ones here who are aging, the ones in 40 and 50s. Thank you for taking care of the adults, buying flasks for them, water flasks. These things are so new. Old people used to walk with a Zumbi, but now the flasks are available. Thank you for the care and generally for a very interactive session this morning. And on that note, I'll just remind you that one, we do have this recording on YouTube. You can share it, you can listen again, and you can make comments. At least within the next few days, it will be on the YouTube. And as usual, Martha will put the link in the chat room so that you don't forget it. And also to invite you to our next session, which will be on the 25th of April, 2026. And it's going to work on preserving the value of our elders, the power of telling your story. I think from the last two sessions, you've seen the usefulness of adults, old adults, and this coming month, April, we are going to help each other keep the value of the adults and also put it in writing or in a record form. Once again, Dr. Byaruhanga, thank you so much. I'm a very proud mother having such a son who has touched our spirits and our body. Thank you so much. Have a nice weekend.
It was a great pleasure. Thank you. Have a nice weekend, all of you.
Right, thank you.